The drug dealers are now brazenly conducting business on the rooftop patio of St. Paul's Hospital.
BC United making explosive allegations about drug use at St. Paul's Hospital.
A concerned nurse says, quote, "We know they are drug dealers, and yet they come and go."
Now the province says it will move to standardize the policies banning illicit drug use at hospitals across all health authorities.
There won't be one Vancouver Coastal Health Policy or Fraser Health Policy or Island Health Policy. There will be one policy, and we're bringing in a task force to put that in place.
BC United claims nurses have described drug use and trafficking, specifically on a rooftop garden at the hospital. Some who work at St. Paul's say the allegations being made in the legislature are inaccurate, though extra security has been brought in for the outdoor space.
As an addiction medicine physician, I can tell you I've never walked through a cloud of fentanyl. It's stories like this that do a complete disservice to our patients and the healthcare providers who are elbows deep in this work and have been for almost a decade now.
St. Paul's is home to a unique peer-run overdose prevention site. The BC Nurses Union says it supports that kind of measure and hopes frontline nurses are on the task force.
We believe in harm reduction, but harm reduction should not come at the cost of harming a nurse or any other healthcare worker. And so, it's an opportunity for us to look at the situation critically.
The province recently announced it had hired 320 relational security officers to help keep health workers safe. Measures BC United says aren't enough.
Putting a task force in place to reinforce rules that they're not enforcing will do nothing. The fact of the matter is that people are continuing to use drugs, illicit drugs, inside the hospital, placing other people at risk.
But some healthcare workers say hospitals need to be kept out of politics.
It's deeply disappointing to see the rhetoric and the false narrative that continues to be spread.
Michelle Kassoub, CBC News, Vancouver.